What's up, everybody? This is Larry with Yunique Medical, and I'm here with Kim Look. Kim is my IV nutrition, ozone, UBI guru. I'm very excited to have her a part of our team because this is something I wanted to offer, but I only like to bring the best people around to do these things because I can't know everything about everything. So Kim, thank you for joining me here and on this team for this effort.
Thank you. It's going to be fun. It's a pleasure being here.
Yeah, we're all super excited. You know, we've been talking about this for a while, but with COVID and pushing things off, it's just been a little bit of a struggle to get it going. But I think we're finally starting to make some headway, and I know that we're all really excited to have you on board. So just for anybody who's watching, give us a little bit of a background about you and kind of how you've come to this and how you've become this guru. Kind of give us a little background.
Kind of feel like saying, how much time do you have, Larry? Because no,
Yeah.
I'm here like everybody. I'm here like everybody else. I had family members. My daughter was born sick, as she's my third child, and I had no health problems with my oldest two. But when she was born, just things weren't right. Her gut was a mess. She cried all the time. It was just an absolute nightmare for years. And the pediatrician had nothing to offer, not really. So I had to look into integrative methods. I had to find other solutions and ended up going a really conservative route, but it was completely new to me. And so I found naturopathic medicine, I found acupuncture, I found functional medicine, and basically taught myself all these modalities. And it really helped her get better. And she's almost 14 now and doing amazing. But it was such a challenge at the time. And I know many of our patients are going to be in that same position. And then I ended up working for one of the facilities that I found in IV therapy with ozone injections, ozone therapies, UBI, lots of nutritional IVs. And we developed this practice that patients were coming from all over the world. So we were seeing some really crazy conditions and seeing some really amazing results. And then a couple of years into that, my mother-in-law developed pancreatic cancer. And so I left there and really traveled the world trying to look for integrative oncology solutions for her. And, the rest is history. That was 10 years ago. And she's still alive, one of the few cases of pancreatic cancer that's still around. I still get calls all the time about, how did you do that? And my daughter's doing well. And so I absolutely feel that this type of medicine could be and maybe is the answer for so many people, whether it's chronic disease, whether it's cancer, whether it's chronic infections, Lyme disease, Epstein-Barr virus, and even just I'm a huge healthy but huge athlete and want to stay optimized. I want to stay healthy forever. I want to live forever, but live well. And so personally, that's kind of where I'm at. And so I love to bridge the gaps between just cellular efficiency, optimization, performance, and even, work with those same therapies to treat people who otherwise can't really find good solutions, things that really resonate with them. So
I appreciate you telling us your story. It's, most of all of us have got our own, story of how we even, get here. So yours is a pretty powerful one. And, yes, a lot of these therapies are going to be great. And we're going to talk mostly about IV nutrition. And then we'll talk about ozone secondary and then ultraviolet blood irradiation, which I think is super new. Maybe people have heard of ozone, and we'll do it in that order. And you definitely hit my buzzwords because in my practice, we are, optimization performance and cellular efficiency kind of like nerd. So, I mean, you definitely hit the high points of what we're going to be using it for. Will we have some ill people, yes. But are we going to be treating pancreatic cancer? Probably not. All right. We're definitely going to stay more along the health, wellness, optimization perspective and develop packages to do that. So that's what I'm pumped about. So let's talk about IV nutrition. Let's talk about, okay, well, what is IV nutrition? I think, the IV bars out there have kind of brought some light to what even that is. So what is IV nutrition and how are we going to be using it in the clinic? And probably what makes it different than the people maybe down the street?
Yeah, in functional medicine, it's a whole platform. It's a whole educational process and even, scope of practice that practitioners can get into. And so to whittle it down, I mean, me personally, I just feel like food matters. I feel like, food's medicine. And what we eat, how we eat it, when we eat it, all those things go into how we perform, how we age. And yet most of us, even people like you and I that are really focused on it, really educated on it, there's just deficiencies that we're bound to run into.
Hmm.
And how do we absorb the food that we eat, the nutrition that we eat? That's a huge factor.
Hmm.
The gut health in those areas. And so really it's the premise that our bodies are made up of carbohydrates, proteins, minerals, vitamins, fats.
Hmm.
These are like foundational pieces that, quote unquote, to quote myself, it makes the world go round. It's what really sets the foundation for how we live, how we function, how we think, how we feel, how we emotionally even process information. Like nutrition is such a huge component. It's not everything. I mean, we have energy and we have hormones and we have other things, but nutrition could be considered to be a catalyst to many of those things. And yet, can we eat it? Can we digest it? Can we assimilate it cellularly so that it can be optimized? And oftentimes the case is no. So to do IV nutrition means that we can introduce very high quality. That's a factor. That one of the differences between where we're going to be and where some of those IV bars are is there are different levels of quality in IV constituents, also quantity or doses. There's a lot of variability on that. And price often determines that. If you're getting something pretty cheap, it's probably low dose or low quality.
Right.
We don't want to be in that space, and we're not going to be. But it's also the assimilation. We're talking like 85, 100% assimilation of these high doses of high quality nutrition when it's done intravenously.
Nice. And you're right. You hit the highlights there that I definitely wanted you to talk about is we are going to be different. We are tailoring these things. We are using high quality, high doses, basically all the things that you want, that you're going to get the money out of the therapy that you're getting. And for those who don't know, intravenous means like in the vein, like an IV. Some people might not even know what that is. So just at a basic sense, we're going to put it intravenously, hanging from a bag that goes directly into the bloodstream and hopefully right into those cells, bypassing all of the digestive system, where there's a lot of problems with most of us, especially if we're on the unhealthy side or a little bit on the unoptimized side. So then when we have a client, we're using IV nutrition as our foundation. All right. So we have to build them up from a foundational perspective. Hopefully most of my clients are already tuned up a little bit. The ones coming off the street probably won't be. So then we say, okay, we're nutritionally going to have a foundation. And then now we want to use ozone therapy to augment the immune system. So this is a segue or modulation of the immune system. This is a segue into ozone. So let's start simple, basic here. What the heck is ozone?
Well, there is some overlap between nutrition and ozone. What most people don't realize is, IV doses of oxidative therapies, of oxygen, of vitamin C, of magnesium, they function differently than the oral doses that our gut will tolerate. And so vitamin C, poly-MVA, there's some other things that we'll have that can function as oxidative therapy, but from a different standpoint, from a different component, a different energy component. Ozone, fundamentally, we breathe O2 and ozone is O3. It's more complex than this, but it's a supercharged oxygen. And, we could go a few days without food. We could go a few days without water. We can't go a few minutes without oxygen. And hypoxia and degradation and aging and bacteria, viruses, cancers, they settle into an environment that is deprived of oxygen. When you get there's a book that's great, some work by Dr. McCabe that talks about, quote unquote, flood your body with oxygen. And when you're oxygen rich, these things can't exist. They can't grow. They can't develop. You're going to always be getting a better supply of oxygen and circulation to cells, tissues, organs. And so you're going to decrease the chances of disease and at minimum decrease the chances, you're going to slow down the aging process with this like supercharged oxygen.
Okay. And then, so since we're talking about how is that administered? So you and I, we're talking primarily intravenous. So how does that even work? So if a client's coming in, what can they expect from that? What does that look like? What does that process look like?
Yeah, it's not the only oxidative therapy. Like I say, like vitamin C can be oxidative. You got like hyperbaric oxygen therapy. There's glutathione as an antioxidant, but it's can provide some oxidative benefits. There's lots of them out there. And so there's lots of different ways to administer oxidative therapies. For ozone, there's many ways. If you're learning about ozone from public figures, from your social media platforms, you're going to hear about so many different ways to administer ozone. And that's what's fun about it. It also can be a little bit overwhelming. We're going to be particular at Yunique at how we do that and how we recommend it, and making sure that the doses and the quality of the procedures is, really important and at a super high level. That's, something that I've been focused on for 10 years and something that you've been focused on. So there's intravenous. That's definitely one way. It's called major autohemotherapy, where you're basically drawing out a little bit of blood and you're adding ozone to it, and you drip that back to the body. That blood carries the oxygen basically back to the cells, tissues, and organs, and creates a whole cascade of effects with enzymes and antioxidants, and it modulates the immune system. So which is really key, I threw that out there, but that means if you have an autoimmune disease and it's like your immune system's overactive or over responding to certain triggers, it's going to help bring that down. If it's underactive, you can't seem to get well if you get a cold or a flu, or you're at risk of things like cancer because your immune system is just always so depleted. It does both. It applies to both types of people here. It's great for inflammation, and that could be in your joints, that could be in your bowel, that could be in your heart. There's so many different applications where this works to reduce inflammation. And of course, from a functional standpoint, you and I are going to work together to say, well, what is causing this inflammation? What might be causing this autoimmune response? But ozone is one of those things that can treat it regardless of the cause, and even oftentimes treat the cause itself. So that's another benefit. It's not just a Band-Aid, it's actually doing treatment. But on the optimization side as well, it just helps cell efficiency. It just helps cells uptake the right information. That could be nutritional, that could be energetic, that could be different components to basically the Krebs cycle, how it processes that information. And then cells should actually detox. They should get rid of what they don't use. They should get rid of junk. They should get rid of bacteria and viruses, this cellular waste that then we have to remove from the body. And is optimized and as efficient as that process can be, that's what determines how healthy we are. So, we've got the nutritional foundation, and then we've got the cellular component that just keeps that process optimized. And then the oxidation or oxygenation might be a better term, so that we keep the inflammation in check, keep the underlying infections and risk of cancers and things in check. And on top of that, it gives us it optimizes like ATP and gives us more energy, helps us sleep better. So if you're just strictly looking at, running that triathlon this summer, then it's going to be a huge component to not only helping you train, recover quickly, and, like I say, keep that inflammation down as you go through that process.
Awesome. And I love the cell efficiency stuff that you keep talking about, and, optimizing. And, as you know, in our clinic, we do a lot of peptide therapy for that exact same thing. They're cell modulators, and, they do a lot of those functions. And what people may not know is ozone isn't new. This has been around a while, right? So what's kind of the history of this? A lot of people are like, oh, this ozone stuff is so new. And it's like, no, this has been going on a long time.
Yeah, I mean, again, we could spend an hour on this at
Right.
minimum, and it's multinational. I mean, we are definitely not the first to discover it or new on the scene. And yet, even though it's not traditionally trained in medical school and nursing school, it's not new, and it was first discovered medically or kind of applied medically in the late 1800s. And there have been hundreds, thousands of studies that have been done on cardiovascular health, OBGYN, wound care, joints, neurological, did I say GI? I mean, it's like so multi-purposed and multi-scoped, because it works at that foundational level, and it triggers responses in our bodies that help things just work naturally. And again, I mean, you and I could nerd out on biochemistry and things like that, but for the people listening, it's just, it's not like what I always say is one pill for one ill. You
Mhm.
know, it's not, hey, we have this symptom, we're going to create this chemical that's going to modulate a couple of responses in cells or chemistry or whatever, to manipulate the outcome. This is like just a natural thing that's turning on other natural processes and helping them work better and helping the body basically heal itself.
Which is what we want to do, 100%. I just want to bring up the fact that there is a lot of clinical research on this. It's not like this is some woo woo, super out of the box mystery therapy. It's been well documented. We have well treatment protocols. We have a lot of good data and research, like you said, in the thousands. So that, this is, it's very safe, right? So what is the safety? So somebody's going to say, okay, well, is this safe? I heard you can't breathe this ozone stuff. So, maybe talk about some of the safety of it. Is it safe?
Yeah, you know what? There's a lot of great podcasts and books out on this right now, kind of like the modern version of
Right.
where ozone sits today versus where it was 100 years ago. But Nick Tesla actually and some German researchers realized this could be really beneficial for medical application, for medical purposes. And we had to go through this process of developing the technology and testing it to find out where we can be most effective and be safe with it. And we've done it. I mean, there's little to no deaths associated with it. There is definitely, the side effects and risks are, like I can count them on one hand.
Mhm.
If you look at a label for a medication, it's definitely a lot more than that. The risk of side effects and going into hospital, like it's really low compared to, when I teach ozone to practitioners, we used to have a slide that was funny, and basically it was like the top 10 causes of death in the world or in the United States, and it would be hospitalization, it would be heart attack, it would be car accidents, those types of things. And we'd also say that you have a bigger chance of having a vending machine fall on you than you do of having a side effect with ozone.
Glad I'm not around a lot of vending machines.
I know. I mean, it's funny. It was a picture, but it was like, this is also true, that
Mhm.
it's really, really safe. That doesn't mean you always feel great when you have ozone, right? The healing process is sometimes a bit of a roller coaster. And when we're asking the body to do something different or to work harder, or we're motivating processes in the body that haven't been utilized or kicked into gear for a long time, sometimes, that makes us feel tired. It makes us feel a little run down. And that's okay. That's the sign that the body is doing what it should do. It's not always a bad thing. But the side effects, the risks, the contraindications, if you're wondering, can I be a candidate for ozone?
Right.
The chances are probably yes. I mean, the list is very, very short as far as what you cannot treat with ozone.
Okay, great. And we're absolutely excited to bring it on. And then the last thing that we're going to be doing that's, maybe not heard of regularly around, our clinic areas is UBI, which is ultraviolet blood irradiation. So what the heck is that?
Well, you know what? Light in medicine is not new either.
Hmm.
It's growing and growing and growing. Aesthetics, pain, muscle degradation, using LED, using low level therapy, red light therapy, blue green. Blue green has been used for bilirubin issues in infants
Yeah.
for decades now. Nobody questions that. That is light medicine. Mood disorders, seasonal mood disorders. Those have been using light therapy for a long time. And then now we've got, aesthetics and
Hmm.
cosmetics.
Hmm.
And again, the studies are, what's the word, prolific. I
Hmm.
mean, there's over 300 studies on just light and medicine just out of Harvard.
Hmm.
Dr. Michael Hamlin is one of the experts over there, who actually spoke with the Trump administration this year, because ultraviolet light is part of that spectrum. There's a whole spectrum of light. There's visible light, there's X-rays, there's
Hmm.
laser, there's infrared, there's a whole spectrum. Well, we're focused on ultraviolet A, B, and C, at least for the purpose of IV therapy here. And
Hmm.
each one of those has a different impact on blood cells. And so the A and B are immune modulators. They deal with inflammation. They focus on T cells. So any of those kind of autoimmune, lupus, MS, ALS, those types of things. And then C is the germicidal. That light is well known to deal with viruses and bacteria, pathogens like cancers, yeast, fungus, mold. So we want to make sure, and we have brought in the best technology with this to be able to include all three of those lights in a very simple IV procedure. Again, we can combine it with ozone and want to combine it with ozone because the studies have shown it works better with ozone. So it's the same needle stick, the same blood draw, ozonate it, ultraviolet, expose the blood to ultraviolet light, and you can get the benefits from both, which we know increase the outcomes by like 20 to 30% from where each one of them is as a standalone. So it really is just drawing blood and exposing it to the ultraviolet A, B, and C light. And you might think that sounds scary, like you're going to cook your blood cells,
Right.
Especially because really correct me if I'm wrong, but really the main idea that we get in healthcare in sunlight is don't go out in it. Wear tons of sunblock, you're going to damage your skin. And yet most of the population is vitamin D deficient. But you kind of think, hey, if I can't sit in the sun without it burning me, then how do I expose blood cells to this light and have it be beneficial?
Right.
And actually, again, lots of research going back to the 1920s shows that if it's done right, if it's done with the right equipment, that there is zero risk to overexposing. In fact, the bigger component is under exposing it. And that's why you have to have the right equipment, the right process. That's why we're making sure we get all that done at Yunique. But if you can expose just small amounts of blood to that light, again, it's an immune modulation therapy. It really helps circulation and oxygenation, which circulation delivers oxygen and nutrition. So when we've got IV nutrition, we've got oxygen going, and we increase circulation and immune modulation. Again, the studies actually, some of the abstracts actually say, we're just giving the body the tools, the circulation, oxygenation, and nutrition to heal itself. And these therapies actually recruit stem cells. They actually activate platelets. And so it's immune modulation therapy, it's circulation, it is detoxifying. It actually helps, again, that cells and tissues and organs get rid of waste. It definitely is germicidal. That's one of my favorite things about it, is we don't really have good solutions to viruses. Even to this day, we don't have medically some really good solutions. Of course, antibiotics were something that kind of kicked into gear in the late 40s and 50s, but they've shown that they have their problems too. And we have resistant strains and things like that. So it brings in a whole different level that has absolutely zero side effects, zero deaths associated with it. It either works or it doesn't work. And it's most likely that it really comes down to how many therapies have you done? How consistent have you been with the treatment plan? And again, that's where you and I are working to put together these really customized, but also high level treatment plans to include all three of these therapies along with everything that you already do.
Yeah, thank you for explaining that. And yeah, when we first talked a while ago, I was looking for, an innovative way to modulate the immune system and cellular efficiency that was other than peptides. Because what I thought was, okay, if I'm using peptides and I'm using something like this, they're all going to have synergistic effects. And when we talked about it, we're like, yeah, we're not going to just do one independently. Let's just do all three so that we could maximize the results and not really offer a whole lot of standalone, but kind of just doing them all together. Let's maximize the immune benefits and the cellular benefits and the health benefits and kind of navigate people through it. And the reason why I got so interested in this is I see a ton of reactivated Epstein-Barr. I just see a ton of it. I mean, yeah, it's just everywhere. And I have these chronic fatigue clients, and you're optimizing, nothing works. And then I would use peptides. But I also feel this is right here is a place for those chronically fatigued people without necessarily doing $5,000 worth of special functional medicine testing. Am I right?
Yeah, absolutely. That's you heard me say it before, like underlying infections
Hmm.
that people aren't always aware that they have, or conventionally, like with EBV, it's kind of like, right, you get it when you're 15 and
Yeah.
take a month off, sleep, rest. And people don't realize that while that can lie dormant, it also can be activated. You know, stress can activate it. It can cause a depletion in the immune system. So now you're sick and tired of all these other things, or from all these other things. And so having these underlying infections can really wear you down and have you age, you know, more progressively, and at minimum affect, you know, your daily life. So with those underlying infections, that's again where I love ozone. I love UV specifically for that, because it's really going to target viral and viral like infections, whether you're, it's like a viral pneumonia that you have right now,
Hmm.
or whether it is an underlying virus that you've had since you were 15. It's really going to help to change those markers and those titers. And can you really get rid of it? That's really an unanswered question. But
Hmm.
can you deactivate it? Can you become asymptomatic? Can
Sure.
you modulate and boost your immune system to, so that you're asymptomatic, you can function like normal? Absolutely. I spent a whole year actually, and the only thing I treated was EBV. And so just 50 patients a day, seeing their markers change, seeing their lifestyles change. I know for a fact that these therapies will be really profound for those patients.
Yeah, and I'm excited to bring this to the area. You know, I've always tried to be super cutting edge and bring things to my local, you know, brick and mortars that just most people haven't heard of, haven't done, but just have, you know, high impact. So I'm excited to do that. I'm excited to work with you on this. So just as like a summary, you know, we're going to be doing this together. So people who are watching this and they want this particular therapy, they're going to have an opportunity to speak with you. You know, that's,
Yeah.
you know, it's going to be, you know, and under, you know, my practice, still be my client, still be a patient, we'll still get labs, but they're going to have an opportunity to talk to you so that you can kind of tell them how this is going to work for their individual needs. Now, being that you don't live, you know, here in Florida and access to you is small, we're going to try to do these group meetings where you talk to people in the evening hours and things like that. And then we'll onboard them in the clinic so that we're making it as simple as possible for them to get started. Um, so that's kind of what it looks like on our end, and how we're going to be utilizing you. And like I said in the beginning, I like to have experts in their area, and you don't have to be an expert in an area and have a degree to do it. So, you know, a lot of people say, you know, I'm a nurse practitioner, you're not an MD, this, that, or that. But the bottom line is if you study something and you practice it your entire life, you can become a guru of it. That's what I did with peptides. That's what you've done with this. So I'm excited to bring this therapy to our clients and just get them, I don't know, even another level optimized. So I appreciate you talking to me. And if anybody has any questions about this, they can comment in any of the videos. We're going to, you know, put this on our social and anything. They can contact the office and we can start answering questions. We're going to try to get this rolled out as soon as humanly possible. But there's obviously some barriers to that. I do appreciate you taking your time today and having this conversation with me. Excited to work with you. Exciting to get some ridiculously good results and move forward with this project. But if I'm being completely honest, that whole thing you were talking about with the UV light and skin, I was thinking about vampires. I'm not gonna lie. That's what I thought about the whole time. Is people are gonna get this UV light in their vein and just blow up. And I was thinking, oh, she's talking about vampires. But anyway,
No,
I'm
it's more like sunshine to the soul. I mean, it's more like, you know, that this gives you energy. It makes you feel good
yeah,
from the inside out. You don't
yeah.
have to be vampires, you know, even though some of us probably would like to be.
Darn,
Um,
I was thinking about blowing up vampires. But anyway, that was super
well, I do
exciting.
get teased for being a vampire because I draw so much blood. I mean,
Yeah, that's true. That's
I'm
true.
always checking out people's veins and what quality they are. And hey, I'd love to hit that and give you some good treatment. So,
Yeah.
yeah, the real goal here is to make this super high end, super high quality. And you and I aren't new at this, meaning that we can absolutely create and will create treatment plans for every patient that makes sense, that's affordable, that's doable, and we'll get those good outcomes because we've got years of experience doing it.
Yes, I agree. And you know, we are pretty awesome in the fact that we're going to do this the way that we're doing it and the way that we're offering it. So this is a cutting edge way of doing this as well. You know, leveraging technology and leveraging collaboration. So I think we're going to do some amazing things together.
There's
And I,
really no barriers right now. I mean, you know, we've got the technology and the collaboration. And so the information can be fluid and accessible, and we'll put out as much as we can and then talk to individuals as they need it.
awesome. All right. I appreciate your time, Kim, and I look forward to working with you and our clients getting to know you. Okay.
You're welcome.
Take care.
Can't wait.